Hi, I'm your host, Marsha Florence, for Just Ask Talk Show. Today's show, ladies and gentlemen, is Integrative Medicine. Hurry back and join us. Hi, I'm your host, Marsha Florence, for Just Ask Talk Show. Today's show, ladies and gentlemen, is Integrative Medicine. And we have what they call the doctor in the house, Dr. Maureen Anderson. Good morning, Dr. Anderson.
Hello,
How are you?
Marcia. I'm doing well. How are you?
I'm glad to have you here.
I'm so delighted to be here.
Thank you. Now, Dr. Anderson, it's always not a surprise, but it's a different atmosphere when the doctor's in the house, okay? So everybody always use that term, is there a doctor in the house?
Yes.
So why don't you tell us a little bit about yourself and what is integrative medicine?
All right. Well, I'll tell you a brief story about my journey because my original training is in emergency medicine and pediatrics and loved it and did it for many years. And then what I realized is, emergency medicine is our current medical model at its best. It works well for acute problems. You break your leg, we fix it. You have a heart attack, we clean you out. But it doesn't work that well for chronic care. And so that's when I began to look at integrative and functional medicine to see if we could do a better job of dealing with chronic illness.
Okay. Now, I know you are at Beaumont / Corewell?
Correct, yes.
Okay.
So most people still know us as Beaumont, but we are now Corewell Health. We are in transition in terms of our branding and website, so you may see contact information as Beaumont, but it will be Corewell at this.
Okay.
Yeah.
So what is integrative medicine? I mean, the name of it itself sounds kind of like, what is that? Is that something new?
Right. It's a good question. Sometimes even my colleagues ask the same question. But I like the Johns Hopkins definition the best. It says it's the science of combining multiple therapies to enhance conventional care. So I like about it because it talks about the science and the research, and it talks about enhancing care, not replacing care. So we're not alternative medicine. We're doing conventional medicine and complementary therapies to optimize health.
Okay, so where does functional medicine fit in there?
Okay, so let me, so for integrative medicine, for instance, for a diabetic, we may have them still on medication, but we might add dietary changes, exercise, maybe some supplements. So that's an integrative approach. Functional medicine asks the question, not what do you have, but why do you have it? So let's say 3 people have migraine headaches. It might be for 3 different reasons. So no wonder when we give them all the same medicine, they don't all respond. So functional medicine really gets to the root cause of the illness.
Okay, all right. But now, I don't know, do we consider that integrative medicine and functional medicine is new on the scene here? I mean, a lot of people don't know it, so how does one know to seek your services out? So are they new programs or have they been around for some time?
They've been around for some time, and of course some of the modalities that we use are ancient, thousands of years old. But for them to be in academic health centers is newer. I mean, we've been going at Beaumont, I think since 2007.
Okay.
But there's a nice, we're a member of the Academic Consortium for Integrative Medicine and Health. And those are academic health centers that all have integrative medicine, and there are 75 members. So all the big names that you can think of across the country have integrative medicine now.
So when there's a convention for integrative medicine?
There is, yes.
Okay. And you guys get to exchange what works in each state or each hospital?
Yes, because it allows for a lot of creativity in terms of how you are delivering this kind of care and what types of modalities you're using. So there's a lot of research going on so that there is more credibility and validity conferred upon what we're doing.
Okay.
Yeah.
But I'm questioning the title integrative, because if I was to go to the doctor, how would he or she know to send me to an integrative medicine physician or program? How would they do that?
Well, some of our referrals are self-referred. You could show up with or without your doctor being part of that decision. Mm-hmm. We often link back to the physician because we don't want to undermine the primary care physician relationship or the specialist relationship. So many people come and they're self-referred, but we have built relationships with many of our physicians, primary care and specialty. So depending on what the interest level is from the patient, because a lot of times patients will say, well, could I take a supplement, or what else could I do for pain? I don't want to do this. Mm-hmm. Then they know to refer over.
Because some people, we know, practice holistic. So
yes.
Is holistic a component in integrative medicine or functional medicine?
I like to think that all physicians are holistic, that they're looking at the patient in context with their family and their community and the planet. I believe that we all practice holistically, and other people do too. There are holistic attorneys and holistic, everybody. So I think we're all holistic, but whether we're integrative or not, varies.
Because people are looking at various ways now, and especially this younger generation, on how to do a lot of self-care compared to going to the doctor. So I was just wondering, was integrative, one of those programs that they would ease into and say, well, I'm not seeing a regular doctor, I'm not going to the hospital, I don't have a OBGYN, but I go to a functional medicine clinic or something. So I was just wondering, how does people try to include this into their decision to make sure that this is what they want to do?
There is a subset of our patients that are seeing us for the first time, that were their first contact with Beaumont, because they're either worried about what might be recommended by conventional medicine, or they disagree, or for some other reason. Interestingly, often once they meet us, and we might say, well, you really do need a cardiologist or a OBGYN, then they're more likely to do it because it was recommended by somebody that they trust.
Right. And I can see people going that way, coming to you guys first and finding out, their conditions or some of the conditions that relate. And then you say, well, along with us, you need to see the cardiologist or oncologist. So somewhere along the line, it seemed like I'm trying to figure out, when do you guys come into play? Is when a person is diagnosed with something and they say, I need to go over here, or is it that they come to you guys first and then you find out what it is and you say, well, along with us, you need the services also?
Yes. All of the above.
Okay. Because if we're in a generation now where, they're doing a lot of self-medicating and, treatment and stuff, it's hard to convince someone to go see a doctor as it is. But what would make it to one of those points where they say, yeah, I'll go see an integrative medicine doctor?
Well, I think some people are more open to that because we're less likely to recommend medication, although medicine is not considered the bad guy. But what we try to do is support so that they can be on the lowest dose possible for the shortest time possible.
Okay.
But you mentioned oncology, and that's a classic example. We're going to talk about our modalities later, but we have a naturopathic physician who does only oncology, and he will often get patients who say, I don't want chemotherapy. And by the end of the conversation, or once they build a relationship, they're often okay with chemotherapy with our support. We'll say we can help you with side effects. We can, decrease risk or enhance efficacy of your chemo. And then we'll work with the oncologist on that.
That's a good thing. Thing. So I'll tell you what, we're going to take a break and we'll be back with some more good information about integrative medicine. We'll be right back.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
And welcome back to the show. Now, ladies and gentlemen, you know me. I always tell you get your pen and paper out. Why? Because you're going to have some information that you have questions for a person like Dr. Anderson or any of the physicians that you see on the show. So one thing, you can always give us a call, 1-800-323-5336, okay? But also you can look at the bottom of the screen and you'll see Dr. Anderson's information. So it's Beaumont Hospital, which will, at the time you see this program, be turned to Corewell, but the numbers will be the same. So always use those phone numbers. And if you have questions, you can give us a call. Now, my concern, ladies and gentlemen, is if somebody's at home wondering about integrative medicine, the cost of integrative medicine, does it take insurance? Who's trained? How do I get there? What do I do? Where is it located? Dr. Anderson is going to answer all those questions. Okay, okay.
Right now?
I had to get that all out. So first question I have is, how is one trained, the staff? How is the staff trained in integrative medicine?
Well, we'll talk about our modalities later, but our standard is that each of our practitioners needs to have the highest level of training in their field. So, for instance, naturopathic physicians are not licensed. These are natural medicine doctors. They're not licensed in Michigan. So that means that somebody who did kind of a weekend course could call themselves an ND. But then there's our naturopathic physicians who went to 4 years of school after college and got licensed in another state and took a big exam and things like that. So you have to really understand what practitioners you're going to, but you can be assured that at Beaumont/Corewell, they all have the highest level of training possible.
Okay. Well, like you said, you're earlier on in your career, you were in one form of treating medicine. So when you switched over, does most of your colleagues do that? Is that how they came about into integrative medicine? They switched over?
The people who are my age, yes.
Okay.
Because it was part of their their journey. I would say that we have medical students and residents rotate with us now, and so they're starting earlier. There are some that actually study integrative medicine as part of their residency training. Okay. We offer that to our residents. Okay. So it's starting earlier with this new generation.
And that's good. I mean,
yes.
I remember when I was in college, gerontology came about, the study of the elderly, and we thought it was funny, like, oh, well. And now gerontology is a degree applicant type program.
Right.
So, and I have my degree in gerontology, but a lot of times people are like, what's gerontology? And we say, oh, the study of the elderly. Oh, okay. But now you can actually get a bachelor's degree in gerontology, which is good.
Yes.
Because if you notice that if we're studying programs or resources about dementia and Alzheimer's and everything, you have to have it relate to something. So we actually have that program in line to better educate people about those conditions overall. So I wanted to ask you, so now I know this is one of those questions somebody's at home is asking, how is this particular service covered? Is it insurance? Is it self-paying? What do they do?
It's sadly not, most of these services are not yet, I'm holding the vision, not yet covered by insurance. The physician services, the MD services, some physicians take all insurance, some take at least Medicare and Medicaid, things like that. Now we have some options for people who can't afford. So for instance, our yoga therapy program has a student-run clinic that's free and they're supervised. Our Reiki program has a volunteer component. So there are ways we can offer this to people who might not be able to afford.
Okay, but first things first is to check and see if they, qualify or, benefit.
Right.
Okay,
right.
Because a lot of people are sitting there and they're like, this is the type of service I need. This is what I want. I don't want to go see a traditional doctor.
Right.
And then when they come to the door, they don't want to be disappointed that, it's not in their budget or, the insurance doesn't cover this. How do I get into this program? So it's almost like, how does your clientele grow, if the insurance is not involved?
Right. And at that academic consortium meeting, which I just attended a couple weeks ago, that was a big topic of conversation. How do we get this out to more people, and how do we get insurance plans to cover?
Right, and it seemed like it would be a part of it. I mean, is it like I couldn't say let's make a deal with the insurance company, but the insurance company's got to know if this is a service that's being provided for people and is working.
Right.
Then there should be a form of billable hours,
Right,
based under the
reimbursement.
insurance, right?
Right. I think it's coming. It's just slow. Now, some people use their health savings account or their flexible savings, whatever that's
flexible
called.
spending
Yes,
account, yeah.
right, to cover these services. And usually when people call to make an appointment, we're able to tell, the front desk is able to tell whether insurance will cover or not.
Okay. But who can book an appointment in integrative medicine?
Anybody. Anybody.
Okay.
I mean, that's the good thing about self-pay is that you don't need a referral. You know, you can show up or call and make an appointment and we'll see you.
Now, is this type of program in all hospitals, or is it just in Beaumont? How is this done?
Well, as I mentioned with that academic consortium, the big academic health centers across the country have integrative medicine. So in Michigan, we have it. University of Michigan has it. I believe Henry Ford actually has it as well. But not all hospitals have it. Yeah.
Okay. And the doctor can actually talk to his or her patient and say, you might be interested in this program here.
Right.
Okay.
Right. Yep.
Okay. I mean, because I'm trying to figure out, if I can just walk in, and I say, what kind of services do you provide? That's the first cue. But if I'm in the doctor's office, would the doctor, refer me to the service, and I can get a chance to come and find out what services is, especially something like, I know we're going to talk about the modalities, but one of mine is that I'm concerned with is acupuncture. So I want to go into that. But I'm just saying, before I come to you guys, I'm at the doctor's office, the doctor tells me, there's another program that you might be interested in, and he gives me a little bit of history or, outline of what it is, and then I come to you guys and I'm like, my doctor told me I could come here. Okay, so that's the part that lets me know that I can utilize it. Is there an age criteria that, most of the patients are? Are they young or middle age, or?
They mostly
what's the youngest client?
The youngest client I've seen has been 2 or 3 years of age.
Okay.
Autism, digestive things. But our typical client is probably 40 to 70.
Okay.
Although some of my dear clients or patients are in their 80s and early 90s. So,
Wow.
it's all ages, but
Okay.
usually, older.
And I was wondering how old was the youngest? And you said
Yeah.
2,
Yeah.
3 years old? Okay. So if a patient is diagnosed with autism or something like that, there's programs under integrative medicine that can be utilized?
There's things that we work with the parents on, strategies to, often dietary and things like that.
Oh, yeah, because a lot of parents are just like, when you find out your child has a condition, you're on search mode trying to find out what you can do at the early stages before it gets too far gone, and especially nutritional programs. So do you guys work with nutritional programs?
Yes, we have a registered dietitian who works with us, so she does some classes, she can work with people one-on-one. So, yeah.
Okay.
Because, yes, diet is the cornerstone of what we do. And sometimes we'll have people come in who say, I want to get off all my medicines. And we say, great, let's start with diet. And they'll say, oh, don't make me give up my fill in the blank, wine, bread, whatever it might be.
Candy.
Yeah.
Okay. Don't take my candy.
Right.
Chocolate at that. Okay. Well, I tell you what, Dr. Anderson, we're going to go to break, and we'll be right back with some more good information. Integrative medicine. We'll be right back.
If you love them enough to suck the snot out of their nose at 4 a.m., then surely you'll check nhtsa.gov/the-right-seat to make sure they're in the right car seat.
And welcome back to the last half of the show. Now, ladies and gentlemen, I know you're saying to yourself, well, in this program, what conditions are covered under here? So Dr. Anderson is going to fill us in on some of the conditions that are covered under integrative medicine. As well, now I should ask you, is it integrative and functional or just integrative?
Our name just says integrative medicine.
Okay. All right.
But our approach is typically the functional medicine approach.
Okay. So some people probably at home want to know some of the conditions. What are some of the conditions?
Oh my gosh. It can be really anything. It can be the well person who has genetic predisposition to diabetes or dementia or something like that, who wants to stay well and optimize their health. It can be somebody at the other end who has seen 15 physicians and is still suffering and is looking for other approaches, and then anything in between. So probably our most common condition is pain.
Okay.
Because we have lots of things to address pain, but digestive issues, cognitive health, mental health, neurologic issues, migraines and things like that.
Okay. What about inflammation?
Well, inflammation is the foundation, the cornerstone of
Yeah.
everything we do. So, I mean, you've heard of inflammaging, things like that. But yeah, so one of our big focuses is to decrease inflammation.
Okay, because a lot of people have inflammation. I mean,
Yes.
it could be hands, your feet, or whatever have you,
Right.
your legs. They're trying to figure out what's wrong.
Right.
Neuropathy, things like that. And they like just, how do I get rid of this? And so now, what about things like fibromyalgia, MS?
Yes.
Any of those fall under you guys' umbrella?
We see plenty of those patients, and we're able to make a difference. And so I think in some ways, part of what we do is offer people hope, because they come in and they have tried everything.
Right.
But we have plenty of other tools in the toolbox that can help.
Right. I mean, I'm in pain, okay, and the doctor keeps giving me prescription for pills. What can I take other than these pills? I don't want to take any pills anymore.
Right.
And at least come in here and find out what the alternatives are.
Right.
Okay.
I often tell people about a study where they x-rayed knees of 100 people over 65, and 2/3 of them had degenerative changes, but only half of those people had pain. So I say there's the anatomy, because people will come in and say, I'm bone on bone. But then there's the physiology, which is the inflammation. So despite the anatomy, you can still decrease pain if you work on inflammation.
Okay, good, okay. Well, I do want to bring up some of the information from the brochure.
Yes.
Okay, so I do know the first brochure we're looking at is which one is this?
Is
I
it
guess
the
this
overview?
Yes, the overview. So, yep, the overview.
Right. So this just talks about our services. This is our basic brochure, which gives you some prices of our services and kind of explains what integrative medicine is and where we offer it, which you see as Royal Oak, Troy, and Grosse Pointe.
Okay, all right. And so the next one, I think it gives a little more detail about what is this?
Right.
Neuropathic medicine.
Naturopathic medicine.
I said neuro. Thank you,
So-
natural.
So these are the natural medicine doctors that I was referring to earlier. They support the body in coming back into balance, and they use natural methods. So sometimes, again, we all start with diet, but they may do some what we call botanical medicines, which are herbs and things like that. And as I mentioned, one of them focuses only on oncology patients, because
Okay.
the research on that is always changing.
Okay.
And then we have two others who do general natural medicine.
Okay.
Um,
So let's
and-
go to our third slide. 'Cause
Well, I will
oh,
just say back to, in addition to the NDs, we have, of course, the MDs. And so I'll just tell you briefly about our visits. Our initial visit is an hour long. We ask you about your entire life history to figure out where you got off track and why. And our physical exam focuses on things impacted by nutrition. And then we might order some testing, and then we'll see you back in a couple of months. But then after that, it's usually once or twice a year. So that's the NDs and the MDs, pretty much.
Okay. That's pretty deep. I was trying to figure out, I should have asked you that earlier. So when the initial concept of setting up the appointment and meeting you, and how do you gain the information, and then all the running the tests and everything. So that was good. Okay.
Yeah, okay.
All right. Okay. All right. So I think we're on.
Now we can get to your acupuncture.
I was trying to get to the acupuncture. So I think we
Right.
went one slide too far over, but I did have a question. So tell us about the acupuncture, because you see, it's very important that people want to know and understand acupuncture before they get it. So-
Right. So our acupuncturist is trained through the traditional Chinese medicine training. There is also Western training for acupuncture, but it's the main part of it is, of course, placing small needles at certain points in the body to help kind of, in the traditional Chinese medicine, it's to open channels and allow energy to flow. In Western medicine, it might be to increase endorphins or promote relaxation or things like that.
Okay.
Yeah.
All right. So then, okay, so I see there was some questions on the second sheet of that. Is, are there any, what is that? I don't know. Some people might have that question. Is it painful?
Right.
Okay.
That's always a big question because there are people who don't like needles. I don't know many who do, but these are very tiny needles, smaller than the size that we use to draw your blood. So it typically, it shouldn't hurt or not much.
So that big question at the top says, what are the conditions that acupuncture can help?
So again, pain, nausea, and other digestive issues. Some say that it can be helpful for sleep and other issues, headaches, things like that.
Okay. All right. Well, I'm coming. All right. So our next slide tells us.
Neuromuscular therapy is pretty much massage therapy. And our massage therapists, again, are highly trained. They're used to dealing with people who are ill and have issues. Chemotherapy patients, have thin skin. There's people who have had surgery who have scars and things like that.
Okay.
Yeah.
All right, moving right along after that is yoga.
Right, so we know the benefits of yoga, but there are many people who can't walk into a yoga class and just do it. So the yoga therapist will see you one-on-one and look at how you think, how you move, and how you breathe, and give you a program that's personalized that you can do at home.
That's great. That's great. All right, so what do we have after yoga? Oh.
Reiki. So this is what's called an energy balancing technique, and it's very good for pain and for anxiety and things like that.
Yeah.
We often offer Reiki to our patients in the hospital.
All right. And after the Reiki comes the pharmaceutical grade supplements.
So we, often will recommend something like fish oil or turmeric, and somebody will come back and say it didn't work. And we say, where did you get it? And they say CVS. Well, for some of these things, brand matters. And so we want to make sure we're recommending the best quality, safe, etc. So that's why we decided to sell our own.
Okay. All right. So I don't think, do we have another one? Yeah. Okay. So you guys provide educational video series. Okay.
Yes. We benefited from a wonderfully generous donor who allowed us to make these videos, so you can click on them on the website and hear a little bit more about each thing.
So we'll make sure that we post at the bottom of the screen that website address, so if somebody is interested in learning more about the videos, they can watch that.
Yeah. Sounds good.
Okay. Well, Dr. Anderson, we can go on all day. Okay, so will you come back and join us again?
Sure, would be happy to.
I really enjoyed having you here, and I learned a few things. So I'm going to have to stop by and get my acupuncture and my massage. I'm gonna get it all. Okay, I'm gonna get it all, girl. Okay.
Good.
So please tell everyone over at Beaumont/Corewell that we said hello and thank you. Having you with us. So, ladies and gentlemen, you know who I am. I'm your host, Marsha Florence for Just Ask, and you know what I always say. But before I say that, don't forget to call us at 1-800-323-5336, Twitter, Just Ask Talk Show, or email me, Marsha at Just Ask Talk Show. If you have a question for Dr. Anderson, her information is at the bottom of the screen, or you can call us, and we will definitely get your question over to her. I'm your host, Marsha Florence for Just Ask, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask, just ask. I'm your host. Thank you.